Hello, everyone. Today I'll be presenting on conflict management and teamwork in the workplace from the perspective of nurses based on the 2021 research study conducted by Sita, and I'm going to butcher the last name, but nursing is a profession built on teamwork, but conflict is inevitable in any workspace. The way nurses respond to conflict has direct impact on teamwork, workplace culture, and patient safety. In this presentation, I will go over the purpose of the study, review supporting literature, describe the methodology, share findings, summarize the conclusions, and reflect on the implications for nursing practice. The purpose of the study, it was to examine the relationship between nurses' conflict management strategies and their attitudes towards teamwork. The research also wanted to explore whether demographics and professional factors like years of experience, educational level, or unit type affects these relationships. This is important because while teamwork is widely recognized as critical to safe and effective care, the role of conflict management in shaping teamwork attitudes has not fully been explored. Understanding this connection can guide leadership training, staff development, and organizational culture. Supporting literature. Research has repeatedly shown that effective teamwork is linked to improved patient safety, higher patient satisfaction, reduced errors, and greater staff retention. Conversely, poor teamwork and communication breakdowns are major contributors to adverse events, increased stress, and nurse burnout. Conflict is unavoidable in the workplace, especially in nursing, where high workloads, unclear role boundaries, staffing shortages, and interpersonal differences are common. To address conflict, Rahim's theory identifies 5 conflict management strategies. Integrating, which seeks a collaborative win-on-win solution. Compromising, which involves finding a middle ground. Obliging, where one party gives in to the other. Avoiding, which delays or ignores conflict. And dominating, where one party asserts control at the expense of the other. Previous research has shown that nurses tend to use integrating and compromising more often, as these strategies support cooperation and professional relationships. However, a few studies had examined whether the use of these strategies translates into stronger teamwork attitudes. This gap in knowledge provided the foundation for the research. This study used a descriptive cross-sectional relation design carried out at a hospital in southern Turkey. The sample consisted of 228 nurses from internal medicine, surgical, and intensive care units. Most participants were female, representing the demographics of nursing in the region. The researchers used 2 validated tools: the Team STEPS Teamwork Attitudes Questionnaire, which measured teamwork attitudes across leadership, communication, mutual support, and situation monitoring, and the Rahim Organization Conflict Inventory 2, which measured conflict strategies like integrating, compromising, obliging, avoiding, and dominating. Data were collected between February and April of 2019 and analyzed using the SPSS with descriptive statistics and regression analysis. The findings were significant. Over 91% of nurses reported experiencing conflict at work. The most common source of conflict was duties and responsibilities, such as workload distribution, unclear roles, accounting for more than half of all conflicts. Other causes included perceived injustice, bullying behaviors, and poor communication. When asked about strategies, nurses most often used compromising and integrating, both constructive approaches. Teamwork attitudes overall were moderate with a mean score of 108. Importantly, conflict management strategies explained 46% of the variance in teamwork attitudes. This means almost half of how nurses view teamwork is shaped by how they manage conflict, which is a very strong and meaningful connection. Some of the conclusions the study concluded that nurses tend to use constructive conflict management strategies such as compromising and integrating, and that these strategies are strongly linked with positive teamwork attitudes. Conflict, when managed well, does not have to be destructive. In fact, it can encourage communication, problem solving, and stronger relationships. The researcher recommended that nurse leaders and educators focus more on training in communication, empathy, and conflict resolution, as these skills are essential for strengthening teamwork and improving overall patient care. For nursing practice, the implications are clear. Conflict management should be considered an essential skill for all nurses, not just leaders. Education and staff development should incorporate training on constructive strategies like integrating and compromising. Nurse managers should model effective conflict resolution and create a culture that values open communication. By doing so, teams can build trust and collaboration, which directly improves patient safety, quality of care, and workplace satisfaction. From my perspective as a nursing student preparing to enter the workforce, this study shows that conflict management is not just a leadership competency, but a core clinical skill. Nurses at every level will face conflict, whether with colleagues, physicians, patients, or families. The difference lies in how we respond. Personally, I believe the study illustrates that teamwork is more than simply dividing tasks. It's about creating trust, and trust is tested most when disagreements occur. The ability to handle those moments with professionalism directly impacts not only workplace culture, but also the quality and safety of patient care. In conclusion, this study by, I'm not going to butcher the name, highlights the critical link between conflict management and teamwork in nursing. The findings are supported by established frameworks like team steps, teamwork attitudes, questionnaires, and Rahim's organizational conflict theory. Together, these sources emphasize the importance of constructive conflict management in building effective, resilient nursing teams. Thank you for listening to me talk for 10 minutes. I appreciate it.